Hi, welcome back to Library Sherry, and today we are going to talking about some of the extended turnaround time happening in Coag department. There is not much things going on over here, so congratulations, it will be a short video. If you have already watched my chemistry turnaround time explanations, I'll put the link over here. In that video, I mentioned about the lipemic sample would causing delays in chemistry department. It happens the same over here in Coag department. When we get a lipemic samples, those samples need to go over to the supercentrifuge for a higher speed and longer time of spinning to remove the lipid in the sample and make it more crystal clear for testing that happens in Coag too. That process is called supercentrifuge. It will take an extra 20 to 30 minutes to do that. That's the time on top of the regular processing time. What also happens in Coag, similar to chemistry, is the dilution. Well, most of the time over here for factor assays, PT, PTT, you don't really need a manual dilution, but D-dimer is one of the tests that can get a skyrocket high number. Occasionally would need a manual dilution. The standard onboarding dilution only get to ×6 dilution, but for patient with a DIC, the dilution factor that needed to get a number can easily go to ×8 or ×10. In that kind of situation, we would need to pull the sample back out from the board and do some manual dilutions on the bench and then put it back for another round of testing. Those manual dilutions would need some time, and it's not as short as 5 minutes. It sometimes requires longer than that because this is not happening that often enough that all the techs know what to do. Occasionally they have to spending some time go to our test manuals in the lab and then checking out what's the proper dilution steps is. It will take a few minutes for them to make sure they are doing it properly. That is very necessary. I appreciate you give them some time to do that. Next one is coming to the Hepzyme. Usually for 1 vial of Hepzyme reagent, it's able to neutralize up to 2 units of heparin in the blood sample we put in. After all the reaction is done, we put it back on board for testing. If we don't see a significant improve of PTT result, the next thing we do is to do another round of neutralization. We don't just give you the result immediately because there is a chance there is extra heparin in the blood samples was not neutralized, and that's the reason it's still making a extended PTT result on board. Well, the chance is low, but we don't want to miss it. So at that point, we will pull the blood sample back onto the bench and redo every single step. Pull another vial, warm it up, do another round of testing. If the PTT result is still extended without any significant improvement, that's the time we'll confidently issue the result out and tell you your problem is not the heparin in the patient's system. A lot of the NICU samples that sent to us, they will go through 2 rounds of neutralization. We just want to make sure all the answers are solid. And now we are already getting to the last scenario that will give you extra turnaround time. See, I promise you this video will be very short. So this one is for the special coagulation. Special coagulation is a place that you're testing all the factors, trying to figure out if your patient is having a factor deficiency or potential antibodies that against a specific factor causing your patient to have a abnormal coagulation time. First of all, if you are working only on day shift or evening shift or whatever the business hours that in your hospital, the only thing could cause you have a delayed turnaround time would be probably when your patient result looks strange. When I say strange, is very, very likely your patients have an antibody against the factor that you are trying to test. Your patient's result will be handed over to a pathologist for the final review and sign off. And that's what happens during the daytime. During the nighttime, it will be a completely different story. A lot of the hospital, you are not even allowed to order factor assays in middle of the night without the pathology approval. And that's for a very good reason, because this kind of specialized testings, we need to do a huge deep clean of our analyzer, especially the sampling probe. We need to make sure there's absolutely no carryovers, no interference that was stuck in on the probe. And we need to prepare the fresh reagent because this kind of specialized testing, the quality control vials only live for a very short period of time, and the quality control window we have is as short as 8 hours, sometimes even shorter. So during the nighttime, we are already outside the quality control window that we did earlier during the daytime. Everything needs to start very fresh. We start from cleaning the analyzer and then prepare new reagent for doing the quality control, and hopefully everything comes in, and then we run your patient. If everything looks fine, you might get a result within an hour or two, but again, there is a chance your patient might be having antibodies or other interference in the blood sample that you gave us. And in that scenario, we need to first eliminate out every single other reason that could possibly causing this by rerun the patient test, re-cleaning our analyzers, maybe even making up fresh new reagent and redo everything again. Do a lot of repeating. After we confirm all the other non-analytical issues are not what causing your patient having a weird result, that's the time we will move on to the next step, which is call our pathology resident and trying to figure out if this is something they consider as an antibody. If this is something serious enough, they should talk to you guys on the floor and all that stuff, and this will take time. So if you're the treatment team on the floor and in middle of the night your patient get to the condition that you totally need to order a factor assay, with the enormous amount of preparation we need to do for this test and the interpretation we need to do after the test, it is very common that you will be waiting for more than an hour for your result. Well, I'm not saying you should wait unlimited amount of the time and just sitting there scratching the table. What I do say is, it is normal for you to have an extended amount of time of getting a result in middle of the night if you are ordering a factor assays compared to what you normally would be getting the result during the daytime. Of course, if you're not having a result after 2-3 hours, definitely give a call. Maybe there is something you need to concern about. Usually if there is a 3-hour or 4-hour delays of your result for a factor assays, that means something is very abnormal with the result, and you might want to call the bench, see if their analyzer is done. If not, you can go ahead straight to get the patient number for the past resident and discuss your thought about antibodies and all that other special scenarios that might be help your treatment. And that's it. See, Coag is one of the departments having the least amount of the things can cause you to have a extended turnaround time, which is very great. Thank you for watching. This is Lab Rat Sherry. Next week, we are going to the blood bank. That'll be the last department in this series about extended turnaround time. And I will see you in the next episode.